July is Fibroid, so try to say that, Awareness Month. It is a time for women to understand what fibroids are and how they can affect their health. Joining us today are three OBGYNs from Brookwood Baptist Health. We have Dr. Erin, Hall-Minnie on the far end over there, Dr. Makenzie Malek in the middle, and Dr. Sarah Whitehead is closest to me. Hey, thanks for joining us.
Thanks for having us.
Good to having you. I'm going to start furthest away right here with Dr. Hall-Minnie. What exactly are uterine fibroids?
So fibroids are benign, non-cancerous, soft tissue muscle tumors of the wall of the uterus, and they can occur inside, in the middle, or outside the uterus.
Okay, Dr. Malek, how common are fibroids?
So incredibly common, actually. Fibroids will affect up to 70% of women by the time they reach menopause, which the average age of menopause is about 50, but not all of those fibroids are symptomatic.
Okay, Dr. Whitehead, what actually causes fibroids?
We're not actually specifically sure what causes them. We know there's some genetic component because the family history can play a role. Hormones definitely drive the process, but really more research is needed to kind of decipher what exactly is the driving factor. Yeah,
Dr. Hall-Minnie, any way that somebody actually knows that they have it though?
So there are many symptoms, heavy bleeding. Sometimes people feel bloated or feel like their belly is growing for no other reason. Sometimes they feel like they have to urinate more or have bowel problems. So there's lots of different symptoms.
Yeah, Dr. Mal, is it painful?
It can be. Sometimes I would say our patients notice it most in times of intimacy or times where, like Dr. Hall-Minnie said, they're trying to empty their bladder or their bowel.
And Dr. Whitehead, when we're talking, do they vary in sizes?
So yeah, some are really small and not really bothersome. You're not symptomatic. Some can be large enough to be the size of a full-grown baby, and you can see them protruding. So they vary anywhere in between there.
Well, we've talked about the subject. We know the ins and outs of it now, but we all really want to know is treatment. So who can handle that for me?
So I think, you know, at Brookwood we offer expectant management. If we just want to watch and wait, we can treat fibroids with hormonal medicine, or we can offer surgery, either in the form of hysterectomy with the assistance of the Da Vinci robot, open surgery, or less invasive approaches.
Yeah, so we don't know, do we have to treat it every single time?
No, so not everybody knows that they have them. Not everybody is having problems with them. When they become problematic, that's when they might need some medicine or a surgery. There's some other non-invasive or minimally invasive options like hysteroscopy or myomectomies.
Yeah, so you think that you all learned something today? I know I did. It's not a subject that I'm very well written on or anything like that. But Dr. Hall-Minnie, thank you so much. Dr. Malek, Dr. Whitehead, thanks for coming in and talking about this.
Yeah, thank you.
We certainly, they did fantastic. Matt, try to understand.